Welcome to Your Health is Wealth, giving you the keys to unlocking better health naturally. Today you'll learn about how to bank wisdom for a richer, fuller life. Your hosts are Dr. Stephen Katz, an award-winning naturopathic physician and former president of the Arizona Naturopathic Medical Association. Dr. Loreena Ryder, a naturopathic physician and current board member of the Arizona Naturopathic Medical Association. And Dr. Hannah Lindsay, naturopathic physician and former board member of the Arizona Naturopathic Medical Association.
Good afternoon and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside with my two co-hosts, Dr. Loreena Ryder and Dr. Hannah Lindsay. We're here every week to help you navigate your journey to wellness. We like to do it simply, without all of that horrible medical terminology that everybody hates. We try to provide practical solutions to your health issues that allows your body's healing systems to do the work for you. It's simple, it's natural, and it works. If you're still struggling with your health, come see us at Naturopathic Physicians Group to help get your life back.
Hello, everyone. This is Dr. Hannah Lindsay, and I'm going to start out just by chatting a bit about what is a naturopathic physician. So a naturopathic physician can provide primary care as well as specialized care. We look at the body as a whole and determine the root cause of your symptoms. So instead of just treating the symptoms you're presenting with, we're going to treat the cause. We initially have about a 1-hour appointment with you to discuss everything in your health. We believe that prevention is the best form of cure, so we like to help you get better and stay better while improving your quality of life.
Dr. Loreena Ryder here with your topic of the day. Every week it's different. Today we're doing Lyme disease. So Lyme disease was first recognized by mapping close geographic clustering of cases in the small community of Lyme, Connecticut, so in the northeastern United States, where there are a lot of trees and a lot of ticks.
Yeah, and Lyme disease is actually the most common vector-borne disease in the United States. And a vector is an organism such as a biting insect, but an organism that transmits a disease or a parasite from one animal to another. And so that's what a vector is, and this is the most common vector-borne one in the United States.
30,000 reported cases to the CDC each year of Lyme disease. And that number is likely much higher because the guidelines are for the diagnosis. And it's an old number, and there is a lot of misdiagnosis as well and lack of.
Because it's most prevalent on the East Coast, doctors on the West Coast are not as good at diagnosing or recognizing Lyme disease. So even though it's 30,000 reported cases, it's very likely to be much higher than that.
So East Coast states usually have the highest amount of cases. This is going to include Maine, Vermont, Massachusetts, and Rhode Island. Although if you don't live in those states, it could still be Lyme disease. That's just where it's the most prevalent. Although not too many deaths are caused by Lyme disease, there are deaths caused from complications from the disease. Unfortunately, when these deaths are reported, they typically blame the symptom or the complication as the cause of death, so the statistics aren't necessarily accurate for the possible Lyme correlation in terms of the death rate.
Yeah, the death rate's going to be much higher with Lyme disease than it is definitely reported, like Dr. Lindsay is saying. If somebody gets meningitis from Lyme disease, which is a complication from it, they're going to blame the death on meningitis and not the Lyme disease that caused the meningitis. But basically, 114 deaths were recorded between 1999 and 2003. But again, it's a very poor number when true statistics would show much higher.
So I'm surprised Pennsylvania wasn't on that list. I'm from Pennsylvania, and I have a lot of friends and just people that I know from back there who suffer from Lyme and Lyme symptoms even before, well before they're diagnosed, and their children too. When I think about growing up, and I used to run through the woods and the high fields and everything, and I've had ticks on me. My kids have had ticks on them. Thankfully, none of us have contracted Lyme disease, but I feel like I moved away just in the right amount of time, because after that, it seems like it kind of went rampant through the town.
There's so many reasons not to live on the East Coast, but Lyme disease is another one for sure. Arizona's a nice, safe, we like Arizona.
Yeah, I agree.
So some symptoms you might experience with Lyme disease. Now, these symptoms may overlap or develop over a period of time. And this is one of the reasons that Lyme disease is pretty difficult to diagnose because the presentation varies so largely. So a distinctive bullseye lesion or rash called erythema migrans, this is about 60 to 80% of people with Lyme disease will get this in the area that they were bit by the tick. So this is a red expanding area over the course of a few days, and it's usually clear in the center, so that's why it's called a bullseye, and it's typically hot to the touch as well. So this is that initial sign right after the tick bite that could indicate Lyme disease.
Now that bullseye rash is so important, but as you said, it's only 60 to 80% of people that get it, which means there's a 20 to 40% chance you don't. The people that don't get that rash have a higher risk of developing chronic complications to Lyme disease because they never knew they got it until they started having chronic issues. So that's one of the things. If you get that rash, you want to start getting treatment right away.
Mm-hmm. Another telltale sign is going to be malaise and or fatigue. And those are different. People kind of lump those together. But malaise is that just general unwell feeling. And then fatigue is just tired all the time. You can also experience some chills or fever, and headache and stiff neck are also pretty common symptoms that you've had or are getting in the process of Lyme disease.
And if you've never actually seen the rash, I encourage you, go on Google and look up the tick rash. It looks like the Target symbol. It's kind of like, it looks like the store. You get that red, the spacing around it, and then you get another red circle around it. It's kind of an interesting look.
It does.
It's like permanent advertising for Target if you get Lyme disease.
So you may also, some other symptoms, you could have facial paralysis, also kind of referred to as Bell's palsy. This can happen in about 9% of reported Lyme cases, so enough to be relevant. You may also have myalgia, a sore throat, could present as GI symptoms, nausea, vomiting, diarrhea. Like we said, it can present in a lot of different ways.
And your spleen can get enlarged, which can affect your red blood cell and white blood cell issues. Joint pain is one of the biggest symptoms people get with this. They're like, I just feel achy. My muscles hurt. My joints hurt. It's just common.
And it can be various joints as well. It doesn't just mean that it's an elbow or a neck or something like that, but the knees seem to be mostly susceptible to that joint pain. And just general overall muscle aches. People will feel that as well. And sometimes even weird symptoms like a sore throat, but you can attribute that to pretty much anything. But also some GI symptoms, nausea, vomiting, and diarrhea are common as well.
And when you start getting to some of the more complications with it, you can really have a lot of problems when it comes to neurological issues. It's one of the tells too for chronic Lyme is they start having major neurological symptoms in there. And these can last for months, but some people that even last for years, again, they can turn chronic. But one of those is going to be something called chorea, which is not the country, but it's a neurological condition that causes involuntary movements, such as it can be as mild as fidgeting to as bad as uncontrollable jerking.
Mm-hmm. Meningoencephalitis is another neurological abnormality. It's a combination of inflammation of the brain and meningitis, so not good to have that. Up to 3% of the Lyme cases will be positive for meningoencephalitis.
There's also cerebellar ataxia, which is a dysfunction of the cerebellum, which is a region of the brain that plays a role in assimilating sensory perception, coordination, and motor control.
We were talking about the complications you can get with Lyme disease. There's a lot when it comes to Lyme disease. And we're in the neurological abnormalities, and one of the ones is called cranial neuritis. So cranial, talking about your cranial nerves, you have 12 cranial nerves that innervate a lot of parts in your face, your ears, your nose, your mouth, you name it. Well, this just means itis, again, is inflammation. We say that every week. So it's basically inflammation of the cranial nerve. So it can cause destruction. It can cause the nerve to be damaged. And it can involve multiple cranial nerves. So it can affect all aspects of your face, your taste, your nose, your hearing, your sight. And that's definitely a complication.
You could also have bilateral Bell's palsy. So this is a condition that causes temporary weakness or paralysis of the muscles in the face. So due to this paralysis, you could experience a drooping face, headache, loss of taste, increased sensitivity to sound, as well as dry eye and dry mouth. Generally, it's going to be one-sided with Bell's palsy, but with Lyme disease, it can be that bilateral.
This really freaks people out when they have a drooping face. I mean, and think about it. That's pretty disturbing. But
and because it's so underdiagnosed, and especially if they're not from the East Coast, they'll have a lot of symptoms like Lyme and have no idea this is what they're dealing with.
Right. Motor and sensory radiculoneuritis is also something to take a look at. It's a transferred pain that is discharged along the path of a nerve branching out from the spine. The pain is felt due to pressure on the nerve at the root and the point of connection at the spinal column. This pain, it says the word itself, it radiates down the nerve root depending on which nerve root is damaged. And this is in up to 4% of reported Lyme cases.
And again, as we're talking about inflammation of the brain, you can have inflammation of the actual spinal cord, which can, in worst case scenario, can even leave you paralyzed. And it does happen. So other than that, your brain's doing great.
You could also have myocardial abnormalities as complications of Lyme disease. There's something called an atrioventricular block that may occur. And to simplify this down, it's basically dealing with your heart. It's either a partial or complete interruption of the transmission of the impulse from your atria to your ventricles. So it's basically just stopping the electrical current that's occurring in your heart, allowing your heart to beat.
Another way Lyme can affect the heart is myopericarditis. This is a combo of the myocarditis and a pericarditis, and this is an inflammation of different layers of the heart. And both of those, the pericardium and the heart muscle, it can involve the presence of fluid in the heart. I mean, yes, there's fluid that pumps through the heart, but this is a fluid that shouldn't be there. And this is also common in autoimmune diseases such as lupus or other heart infections.
And in the book, The Grinch Who Stole Christmas.
I know that book.
Yeah, at the end of it, his heart gets enlarged. He might have had Lyme disease. He's green, but different Lyme. But in general, though, when your heart gets enlarged, cardiomegaly can also be a complication with Lyme disease. In the beginning, he didn't. So then he saves all at Christmas, and then he gets Lyme disease, and his heart gets too big.
I don't know. I mean, are there ticks in Whoville? I don't
know.
Wow.
You know?
You'll have to check.
Yeah, that's a good question.
So cardiomegaly is, like Dr. Katz said, it's an enlarged heart, but it also can increase the risk to many different heart conditions. And this could present as shortness of breath or difficulty breathing, especially when active or when lying flat. It could be weight gain, particularly in the midsection, feeling tired. You could have palpitations or skipped heartbeats, as well as having chest pain and even swelling in the legs.
It's been a rough show so far.
Oh.
This is a really serious condition that has a lot of problems. But causes of this, again, we've talked, this is a tick-borne infection. It comes from a bacteria known as Borrelia burgdorferi. And again, you're usually infected within 3 to 12 weeks after the lesion, after the bite. And then you can start having problems within a few days to weeks after the actual infection.
Yeah, honestly, like if anybody tells me they're Lyme positive, I instantly feel bad for them. It really is a tough disease to deal with. But whenever you're talking about the tick bite, the tick size, it's actually very important. So 1/8 of an inch for larvae to 1/4 of an inch for an adult tick. They're tiny.
Did you just say the size of the tick matters?
I did. You heard me right. Females are larger than males. The larger the tick, the easier to spot and the more likely to remove it before the effective transmission of the Lyme disease, because some of them can be so tiny, they just look like a little tiny dot. You don't know they're there longer, and then they can transmit that disease to you.
Tick size should not matter.
Tick size does matter.
This is why it's important if you do live in one of these high risk areas, especially if you're outside and in high grass, you want to be checking yourself for ticks. They like to hide in folds in your body, armpits, you can imagine where they like to hide. So you want to be pretty thorough, make sure that you're catching them, and the sooner you pull them out, the less likely you are to have Lyme disease.
And much like every other condition, if you are immunocompromised, you have other diseases, you're way more likely if you're bit by the tick for it to turn into a chronic Lyme issue. So we're going to get into diagnostics now, and I always do a segment called What Isn't Your Doctor Telling You? This is a interesting one because according to the CDC criteria, you have to have at least 5 out of 10 IgG Lyme antibodies on their test called the Western Blot test found in the blood to be officially diagnosed with Lyme disease. So when you run this Western Blot test, it measures 10 different antibodies to Lyme disease. You have to be positive on 5 of them before they will actually tell you that you are positive. I find this, and I hate to say that, but I find this ridiculous on every level, because if you have 3 of them and you have every symptom of Lyme disease, you have Lyme disease. But they'll tell you, no, you're negative. Again, why so few people are diagnosed with this or wrongfully undiagnosed with this, because the criteria from the CDC is ridiculous. And I'm going to say that, and it's honest, whether they agree with me or not. But this means there are so many people that are told they are negative for Lyme disease, and they are positive. So if you think you have Lyme disease, you need to see a naturopathic doctor, and they are far better at listening to the patient and getting you to the right cause and diagnosis. Because if you have Lyme disease and you go to your primary care and they tell you you're negative, but you have 3 antibodies, 4 antibodies, 2 antibodies, and you have all the symptoms, you're going to get poor care and you're just going to turn chronic, which I hate to say that, but it happens every day.
I agree. Traditional diagnostic tests that let's talk about that what you were talking about, if you go to a traditional medical doctor, they will typically do the Western Blot. Now, this is helpful, but it usually ends up turning negative. You have to catch the disease in its replication cycle. So it's not as if it will just turn positive all the time. You have to catch it at the right time. And then in that, there are specific Lyme bands. Now, they have numbers, 23, 30, it doesn't matter. But these indicate actual exposure to Lyme disease.
These do matter.
Well, they do matter.
Just like the size of the tick.
So at traditional diagnostic tests, you could also potentially do an MRI of the heart and brain to assess if there's any damage, but that's not going to appear unless the patient is experiencing the neurological or cardiac symptoms, those complications of Lyme disease. So at this point, you'd already be far down the line to have the damage to show on an MRI. You really want to think about better testing to catch it before that happens.
Yeah, and as we say each week, we're going to get into some traditional treatments. As we say each week, we discuss both traditional and naturopathic treatment options. We are not giving you medical advice. We are giving you information that you can use to discuss with your practitioner on your best options moving forward with your health.
So why is Lyme so difficult to treat? Why can't we figure this out? Well, there are things called biofilms. The bacteria in Lyme disease produces and covers itself in a slimy substance called mucopolysaccharide. It's kind of gross. It then recruits fibrinogen. It's not. It is. It's like a big old glob of boogies. But then it recruits fibrinogen, which is a protein from your blood, and creates a protective skeleton, or like a little coat, around the bacterial colony. So that's what a biofilm is. This allows for the bacteria to hide and evade your natural immune system killer cells.
So treatment would generally begin once that bullseye rash forms, which is the first noticed sign for most people. And early treatment is going to increase your chances of a full recovery. But however, like we said earlier, when no rash shows up, which is approximately in 20 to 40% of cases, they're generally not treated early because they had no early sign of the disease. So your traditional treatment would be an antibiotic combination of doxycycline or amoxicillin with
Basically, they do combination things. All they have for Lyme disease on a conventional side is antibiotics. They give you doxycycline or amoxicillin with the cefuroxime. They usually give it to you for 14 to 21 days, but here's the caveat. If you're not feeling better after 14 to 21 days, they still only have that. So they give you more antibiotics. There are people that will be with Lyme disease that will be on antibiotics for months and months, completely wrecking their GI tract, making them more susceptible to other infections out there. Again, we're not telling you not to do it, but if you're not getting better after that round or two of antibiotics, you better seek some other care if you want to get in control of this.
Yeah, not to mention the side effects from antibiotics. Then you have that. You have the abdominal discomfort, the diarrhea, nausea, vomiting.
And with doxycycline, it can turn your teeth brown and gray. Awesome for Halloween. Happy late Halloween, everybody. But for long term, you probably don't want brown and gray tooth discoloration.
So let's get into some naturopathic testing. So there are really great tests that we use as naturopathic doctors that are tick-borne and full Lyme panel. What they do is they take a look at your immunoglobulins, so your IgMs, your IgGs, and there's also PCR testing. And it tests for 123 different variants and co-infections. So this is key because when someone has Lyme disease, then the immune system is weakened, right? So with a weakened immune system, there's so many co-infections that can show up, and they're often missed and undiagnosed by conventional medicine.
And again, when the CDC requires you to have at least 5 positive antibodies to it, so many people are undiagnosed or told they're negative when they are positive. So when you run a tick-borne panel, not just a Borrelia burgdorferi panel, you can see how many co-infections you might actually have. It's not to scare you. It's just so you get the proper diagnosis. There are strains, because they're called comorbidities, like you said earlier. You can have Babesia, Bartonella, the other strains of Borrelia, EBV, Anaplasmosis, on and on and on, Rickettsia, Ehrlichia, Coxsackie virus, CMV, HSV. It's a lot of information, but you can have these with your Lyme. And if you only address one problem, you'll never feel better. You'll never get to the bottom of it. You need to know what's happening in your body. And especially if you're immunocompromised, it's more common.
You also could do a food sensitivity panel in order to assess immune system function and diet correlation in order to ensure that you're not inflaming your immune system while treating a chronic infection. If you have food sensitivities that you're not aware of and you're eating them on a regular basis, this isn't going to do any good for you. Well, if you already have something like Lyme disease, your immune system is going to be hit harder and harder, and you're going to continue to inflame your system.
And we talk about food panels pretty much every week, but it's really important to know when 80% of your immune system's in your digestive tract. So if you are immunocompromised or you're having chronic issues, you should know, control what you can control. I say that almost every week. You should know what you're putting in your body and how inflamed it makes your body, because if you get Lyme and your system is weak, you're way more likely to turn chronic.
Mm-hmm. And also naturopathic doctors will do a physical exam, and also we'll use common sense. So if you have symptoms...
Common sense?
I know.
What's that?
Right? Well, hopefully your doctor is using it, but if not, good luck. But if you show symptoms of Lyme disease and you have antibodies, and even if it's not 5 of the different immunoglobulin G strains, and it's obvious that you have Lyme disease, you need treatment.
The most common thing about common sense is the lack of it.
Oh, my.
So now we're going to go into some naturopathic treatment options. And again, when we discuss both traditional and naturopathic treatment options, we are not giving medical advice. We're simply giving you information that you can use to discuss with your practitioner on your best options moving forward with your health. So diet, like we said, we can run a food panel, and we're going to put you on a diet according to what comes back as food sensitivities for you. So we would follow this diet, avoiding all inflammatory foods, as well as we typically are going to recommend no gluten and no dairy.
So if you run a food panel, this is the mean part of us. If you run a food panel, even if dairy and gluten come back not as an allergen or a sensitivity, it's still good to not do it, because it's still inflammatory.
Mm-hmm. We're not baby cows, so why would you drink baby cow milk?
And chickens, eggs are a common sensitivity. If you're sensitive to that, you should not eat a chicken's period.
Here we go.
Here we go.
So cruciferous vegetables, do we talk about that? They contain sulforaphane. That's anti-inflammatory to the brain, which is a good thing, and may help decrease neuroinflammation caused by Lyme disease. Other benefits of cruciferous vegetables are hormonal and decreased risk of breast cancer and ovarian cancer. Now, if you don't know what cruciferous vegetables are, obviously you can do a Google search, but they're things like broccoli and greens, kale, all that.
Cauliflower, bok choy, all those delicious vegetables that every 5-year-old seems to hate.
Right.
But how much cruciferous vegetables do you have to eat to get true potency?
That's a good question. Do you have a number?
No.
No.
But
It's a lot.
It's a lot. But a little bit every day in your diet can go a really long way. If you're talking about supplementing stuff like cruciferous vegetables, like a broccoli extract, it's like eating pounds of broccoli in a capsule. So way more potency when you're talking about the benefits of those sulforaphane. But if you eat a little bit of broccoli every single day in your diet, a little bit of cauliflower every day in your diet, it can do wonders for you.
It's a lifestyle thing.
Cauliflower is just about made into everything these days. You can do cauliflower rice. I know quite a few people even would put frozen cauliflower into their smoothies instead of a frozen fruit because it doesn't have a very strong flavor to it. So if you're using a protein powder that's flavored, it usually masks it anyway. So you can drink your cauliflower in the morning.
And it's a great way to make healthy dishes, too. When they have the cauliflower rice, it mixes really well. It's pretty neutral taste, so it doesn't, you can put almost anything with it, and it tastes really good. And now you're not getting all that garbage carb, heavy feeling rice.
I saw this meme that had a Reese peanut butter cup on there, and it was like, can somebody show me how to make this out of cauliflower?
I saw organic Reese's.
What?
I saw organic Reese's. Isn't that crazy?
That is crazy.
Yeah, I saw it at Fry's.
Oh, wow.
Now, it doesn't mean it's healthy. I'm not saying
They
go
have
get organic
sugar.
Reese's. I was just shocked. I was like, wow, organic candy bar. That must be healthy.
They do
Not.
that, right. They do that to convince you it's healthy when it's still very
It's-
much not.
It's still crap.
I wonder if it
It's a
tastes the
buzzword.
same. I'll taste it.
I
and I'll
can't
let you
imagine
know.
it tastes the
I'll
same.
take the hit.
You take the hit for
Yeah.
the team.
Yeah, twist my arm.
I ain't doing it. But prevention is the best form of cure. As naturopathic doctors, we love prevention. So how do we prevent Lyme disease if possible? One, the diet, of course, take care of yourself. But it's a tick again. We have to try and not have the tick even get on your body.
Yeah, you can't walk around with a tick repellent suit on like a beehive suit. So what do we do?
Well, you could.
We could, I guess. There's no fun in that.
There are some topical tick repellents you can use, like cedar oil spray, eucalyptus oil, neem oil, apple cider vinegar, as well as eating raw garlic can even act as a tick repellent.
Yeah, if you eat a lot of garlic, it keeps a lot of things away, including people.
It's a pretty strong repellent, that one.
Vampires, happy Halloween again.
And neem oil doesn't smell very good either. So maybe ticks just don't like bad smells.
And then there's some supplements. Again, we always talk about supplements. One of the things that a staple if you have Lyme disease, vitamin C, we talk about that almost every week. Immune system support helps kill infections. And there's been tests and studies that have shown that if you have low levels of vitamin D in your body, it's way more likely that your Lyme will turn chronic.
Okay. Olive leaf extract is really great as well. It's shown to help kill Lyme bacteria as well as the symptoms of body aches and fever during the acute infections.
Echinacea is a natural antibiotic that helps enhance the body's ability to create white blood cells, which fight against toxic substances like the pathogens generated by ticks.
Vitamin D. I love vitamin D. It's really, and it seems to be so hard for people to hang on to. And even people here in Arizona think that you have high levels of vitamin D just because we live in Arizona and we have the sunshine, but that's not necessarily true. But it's really great for reducing the Borrelia infection, reduces your vitamin D receptor expression in immune cells. So it's super important to have that vitamin D help fight Lyme.
And another one we talk about a lot, NAC. NAC is N-acetylcysteine. It produces something called glutathione in our body, which is needed for detoxification. But it also helps protect you from die-off when you're killing the Lyme disease. When you kill off pathogens, a lot of times they will send out a poison or a toxin into our system, and this helps the body detox better.
Welcome back to Your Health is Wealth. I'm Dr. Loreena Ryder alongside my co-hosts, Dr. Stephen Katz and Dr. Hannah Lindsay. We are here today to discuss different topics on health and natural ways to treat them. Today, we are talking about Lyme disease.
So in our last segment, we started talking about different supplements you can use to treat Lyme disease, or at least the effects of Lyme disease. One of them is one we've talked about in the past as well, called monolauric acid. Monolauric acid is actually made from coconuts. You can treat, I can't even do it.
We're waiting, do it.
Treat the Lyme with the coconut and fix it all up.
You're done.
I'm done. I'm done for the
He got it out, so.
I'm done. No, but coconuts are antibacterial, antiviral, antifungal, so they can treat a lot of different things, and Lyme is one of them. All of these, and it's actually been tested, and it can help fight Borrelia burgdorferi, the bacteria that causes Lyme disease. It also helps improve gut health. It can make the probiotics work better, so it protects you long term as well.
Vitamin A deficiency has been found to specifically exacerbate the arthritis that's associated with Lyme disease. So taking vitamin A could potentially help this. It also can improve the body's ability to fight the infection.
Zinc is really, really great. Low levels of zinc in your body have been linked to an increased risk of chronic Lyme disease.
Now, we talked about earlier in the show that Lyme disease forms a protective barrier, almost a skeletal-like barrier around it to evade the immune system called a biofilm. So there are a lot of supplements out there that help the body break down these biofilms so your immune system has a better chance at fighting off this pathogen. So this can not only help kill the Lyme, but it also helps kill those comorbidities that we talked about earlier. And one of those is curcumin. Comes from a spice, turmeric, but curcumin, there was a study done in 2014 that showed that curcumin was a very effective antibacterial and helped fight off Lyme disease.
I love curcumin. I sprinkle that on almost everything I can, but it does stain your fingers a little orange or yellow. There's also oregano. This is a well-studied active constituent, and it's called carvacrol, and it has been shown to inhibit antibiotic-resistant bacteria, viruses, parasites, and fungi. It also helps stop the release of toxins that are released by these pathogens, including bacteria with biofilms.
And so as you see with a lot of these natural treatments, they're high functioning but multi-purpose. They kill bacteria, they kill fungal, they kill parasites, they kill a lot of different things, but it's because they work with the immune system to help the body kill the pathogens. That makes a huge difference because antibiotics, antivirals, antifungals, they serve one purpose. These are multi-purpose ingredients.
Mm-hmm. Another biofilm breaker is berberine. This is great for many conditions like diabetes as well as other chronic infections, but it specifically can help remove that biofilm layer from the bacteria, and it allows the immune system to kill the pathogen easier.
Mm-hmm.
And we talked about garlic earlier, how if you eat it raw, we didn't say why it actually helps. Well, it contains a constituent called allicin, which is antimicrobial. It's also been shown in studies to disrupt the bacteria's ability to form that biofilm protective layer. So if you're eating garlic, if you're taking a supplement, and they have supplements out there that have garlic extract, they also have supplements out there that just have the allicin in it. And if you're taking that, you stop the Lyme disease's ability to make those biofilms. So you're able to kill it better.
Mm-hmm. IV therapy is another really great therapy to help with Lyme disease. And also, if you have GI problems associated with chronic Lyme disease, IV therapies can become your best treatment option. So let's talk about some of the IV therapies that we do at Naturopathic Physicians Group. One of them, one of my favorites, is an ozone IV. This is oxygen therapy, and it can help improve your immune system function. It can also help break down the biofilms that we're talking about and kill the bacteria. So Borrelia is an anaerobic bacteria. That means that it's anaerobic means without oxygen. So it likes to live without oxygen. So if we're giving you an ozone IV, we're giving you oxygen, and that can actually kill it. It also improves cardiac function, for those Lyme patients that have damage to the heart that we were talking about.
Yeah, we talked about ozone in a previous show on oxygen, as how oxygen is a blood dilator. So what that means is it opens up your blood vessels and allows blood to flow better throughout your system. So you get better blood flow to your brain, better blood flow to your kidneys, better blood flow to your liver, better blood flow to your lungs, your whole body. So it's going to get all of those organ systems working better, so you have more efficient detox, better breathing, better brain function, as well as being an oxygen. It kills off those anaerobic bugs like Lyme disease.
Another IV therapy option would be a nutrient IV with glutathione. Nutrients can help to improve your immune system, fight off infections, as well as improve the neurological or cardiac symptoms of Lyme disease. And glutathione can help to increase neurological function with chronic Lyme patients, as well as improve detox pathways. So if you have some of those GI symptoms with Lyme, there's a chance you're not getting the nutrients you need from your diet. Maybe your GI tract's not absorbing them properly. So being able to get those nutrients intravenously might be your best option.
And the earlier you get treatment, just like on the conventional side, the earlier you get treatment, the less likely it's going to turn into a chronic issue. You've got to get your immune system working to fight it before it's taken hold into your system. So that's when, if you do the glutathione IV or the vitamin C IVs, when you get those nutrients in your body earlier, you give yourself a fighting chance.
Mm-hmm. Another IV option is PPC. We call it PPC because the long word is phosphatidylcholine. This helps with the damaged nerves that are associated with Lyme patients that have had damaged neurological functions and nervous system function, which is unfortunate. But this helps improve communication from the brain and the spinal cord to the rest of the body, because that's how nerves work.
In the same show, we've said PPC and size of the tick.
We have.
We're getting worse each week.
It's okay. Keeps it interesting.
Maybe. And ALA is one we've talked about many times. If you're having neurological issues and you're having nerve damage, like we talked about all of those nerve issues associated with Lyme disease, ALA helps protect those nerves. It's also really good at making your immune system stronger. It's another option you can do both as a supplement or an infusion, IV infusion. And again, there's so many different IVs out there, but understand that when you come into the office, when you see your doctor, we put together a plan that's individualized for you based on what you're going through. It's not like we're just randomly saying, oh, this IV, let's try this IV. No, it's based on you, the individual.
There are some botanicals as well that can be used for Lyme disease, and we've already mentioned a couple to be used as a tick repellent or even a biofilm breaker. But Dioscorea villosa, also known as wild yam, is another one used, and it is a really strong inflammation modulator. It's really often used for rheumatoid arthritis, but it can be used specifically for the arthritis that is sometimes in conjunction with Lyme disease.
Yeah, just like Lyme disease, RA has those joints that get painful, and so that will help both conditions. And there's also homeopathy. You know, when all else fails, I find homeopathy to the rescue. And there are some physicians out there that will use homeopathy first, but I find it very valuable. Arsenicum album is one that will address the skin eruptions, like that bullseye rash that we were talking about. And it will also help with the burning and painful parts after scratching. And it will help with the neuritis or the inflammation of the nerves that are there in the peripheral like tissue, the arms and the legs.
There's also belladonna, which also can help with the skin if you're having extremely high fever with your Lyme, if you're having a lot of those joint pains and headaches with it that have that throbby feeling, that's a remedy that can help.
Mm-hmm.
Mercurius is another homeopathic. This is typically going to be used when you have redness upon when vesicles or blisters are going to form and pour out a thin, clear fluid. It could remain for a week to 10 days. It can also be with a fever, with profuse perspiration and a creeping chillness, even swelling of the feet and the legs.
Mm-hmm. Rustox is another homeopathic that will help with the redness and the itching. This is something I wish I would have had as a child when I got poison ivy all the time in Pennsylvania running through the mountains, but it's really great for Lyme as well.
So thank you for joining us today on Your Health is Wealth. We'll see you next week for another great episode of Your Health is Wealth.
be sure to tune in next week to learn more wisdom on how to live a fuller, richer life. If you have questions about today's show or would like to find out more about the topics we discussed today, call the Naturopathic Physicians Group at 480-451-6161.